Hello and welcome to Keeping It 100. As usual, I'm with my beautiful, I won't say ladies, my sisters. I think of them as my sisters. I have the lovely IJ here.
Hi.
And the sweet Yetunde here. So today
You don't look sorry, Jay, you don't look bad.
You look
yourself.
Gorgeous.
Thank
like
you.
a million bucks.
I like the whole
Thank you.
Sissy look. It's
Thank
fresh.
you, ladies.
Yeah.
You look absolutely stunning.
Is my head, has it?
has
I feel
swollen.
like
It has
the size
doubled
has
in
doubled.
size.
Thank you very much, Yetunde. So today we will be talking about hospital matters. Now, when we say hospital matters, what do we mean? Today we are going to be talking about those nurses that that behave one kind. The cranky doctors. Or is it the bills that they slam us when we go to these hospitals? That is what we're going to be talking about today. We're going to dissect it. We're even going to talk about the hospital security because we've had serious issues with those kind of things. So that is what we'll be talking about today. So ladies.
Yeah, I've collected it.
Ladies.
Collected it. I can't wait. I can't wait. So you see this cranky nurses of a thing. The left side of my is still paining me till today. I went to the hospital and this nurse didn't just like me. I didn't do anything to her. I was just ill, minding my business, ill. Entered the nurse's station. First of all, she held the injection like a dagger. I was like, where are you? Where's the patient? When I saw her, I said, hey, God, help me. I'm telling you.
like this.
Stand there. She told me to stand there, and then she stabbed me. I screamed. I was like, what is it? I said, I didn't want to react too much because the needle was still there. Let me not shake, and then she would just vex and just rip it down. So I stayed still. When she was done, I said, what do you think you just did? She said, sit down somewhere, Jerry. But the fact is that she wasn't careful enough. I'm a patient. You're giving somebody injection. You don't even know whether the person is... Some people are scared of injections.
A lot of people
you don't think that you should pamper me a little and say, oh, don't worry, I'm not a child, but just say it won't hurt. Don't carry the thing like dagger, waiting like the executioner, waiting to take me out, which is exactly what she did.
They really don't care. Like when I had my second baby, I was still on the delivery bed, you know. I hadn't been stitched even, like fresh mom, just popped out a baby. And then the nurse goes, while cleaning my baby, she goes, madam, did you take your prenatal drugs at all? Did you take them at all? And I went, what do you mean? You know, I was worried. I just popped out the baby. You're the first person that's seen this baby. Is there anything wrong with my baby? I said, her skin. Me, I don't understand though.
You are joking.
Okay, I was like, even if you want to tell me such a thing, wait now. Let me get to my word.
What does she mean me? I don't understand though.
Do you know, like, what's the first immunization a baby goes in for? I think 2 weeks or so, the first one. It's been a while, I can't really remember myself.
I
think BCG is at birth. Then there's one you go for like 2 weeks. When I went back for that, all the nurses were, you know, praising my daughter, like, look at her skin. Oh, she's so, this baby, can I take you home? You know, hailing the same skin, and I was happy that nurse was present while all this was happening. And she just kept quiet. Well, you know how they would just be talking to you, and I just kept staring at her and holding my baby like, are you listening? Like, why so mean? What did that ever do to you?
Nurse, wherever you are, that was a newborn baby.
Newborn baby.
Like, if you can be nasty to a newborn baby, there's no hope for you.
No hope whatsoever.
No hope.
And then she went on to say, hey, is it the original one? I said, I bought it from this hospital, this establishment. Because I'm one of those, I like to buy things there, so they won't say, you brought fake, or you did this. Why so mean? And especially to pregnant women too.
That was what I was going to say. Nurses, doctors out there, we love you, don't come for us. And nurse, if you're watching, don't give me another, next time I come, don't mess me up. But the truth is that it's a hospital. It should be a nice experience.
Your bedside manners really should matter. So mine wasn't even my own personal experience. It was my mother.
Okay.
As a young bride, unfortunately, my father's occupation had to take him away from her. He wasn't with her when when she gave birth to me. She was really young, and I was really sickly as a child. I was, you know, always in and out of hospital. So there was this time, I think they had just discharged us from the hospital. I was still a baby, you know. My mom said I was, you know, she put me on her back. She was at the bus stop waiting for a bus. And because she was so tired, you know, she did not know that I had started convulsing at the back.
Oh, wow. That's
So,
scary.
yeah, passerbys had to tell her that, madam, your child.
Wow.
So, turned around
To the hospital.
And what would this nurse say? As my mother was running in, you are back here again. You are back here again with this child. I've told you this girl will kill you. Go and dump her under Iroko tree. Let her die.
You are
She
joking.
needs you. Yes.
You are joking.
Yes. This is what she said to a woman that, I mean, my mom was a young mom. She was 18, 19. She was 18 when she had me.
That was
goodness.
in panic mode. You know?
That is what she said to her.
That's highly insensitive.
Said to her. Unfortunately for her, I got to hear this story as a teenager. And I knew, she was still in a medical profession, still a nurse. And she was also still working at the hospital where we started using, my family started using. So I hated her. I hated her because the thing is that she had not even changed. She was still that nasty person, always yelling at patients, always. So for a long time, I didn't like nurses. I just thought they were all mean and they were all, you know, until I actually had a talk with my auntie who was also a nurse herself, and she was like, no, it has to do with your personality. It's not a nursing thing.
I think they need to be trained specially, you know, for good, train them to
Exactly.
have good hospital etiquette.
Exactly.
Good behavior. It's a noble profession. So if you're ready to go into it, you're ready to take whatever comes.
You see, the thing, Nigerians, we love Nigerians, but we just feel like when I go to the hospital, I should be at the mercy of the health caregiver.
Yes.
Which is not the case, which shouldn't be the case. You should have confidence in the health caregiver.
Yes.
To the extent that you can trust them enough with your life because it's health. So when I come into a hospital and the doctor is cranky or the nurse is nasty, already there is a problem.
Yes.
Your state of mind as a patient is already perturbed. You're already like, oh my God, what is this? Exactly. At the end of the day, you may not get what you want from the patient. They may not be able to confide in you truthfully about their symptoms.
Have their guards up already.
Yes. Till today for dentists, for going to the dentist. Why? Because my first time ever of going, this I don't know. I think he was having a bad day.
It doesn't matter, really.
I'm trying to understand why that man put me through what he put me through. You know, so they gave me the numbing whatever, and I was still feeling pains, and this guy was hammering and chiseling away. By the time he finished with me, I had sores all over. My father had to go to the hospital. My father is a very peaceful person. Popsi is not the kind of person that will go on. He had to go to the hospital to go and have a word with that man. But see, we're getting into it, and if we don't, we have to go and pay our bills, please. So we'll take a break and we'll be right back.
Welcome back to our exciting show, Keeping It 100, where we gist and banter about many, many issues that affect us on a day-to-day basis. Before the break, the ladies and I were chit-chatting about the nasty dentist, the one that brutalized our dear Jay's jaw.
Yes, so
to the extent that Daddy had to go there and have a strong word with the dentists. Dear dentists out there, we love you. You take care of our teeth, but please do it with care. Don't be so. You can't be operating on somebody's mouth and be nasty and cranky and angry.
And be angry. I think he was especially angry because I kept saying I can feel the pain, and he was still, you know,
chiseling away.
Chiseling away.
It's
Well,
like
sure
he was angry that my root or whatever was refusing to come. Is it my?
There are a few nice medical or healthcare giver professionals out there. They're there, but if I'm speaking from experience, so I have not encountered many. The majority that I have encountered are extremely cantankerous.
They are abrupt. They're always in a hurry. When you even say hello to them, it's like you're wasting their time.
Yes,
True.
yes.
I don't understand.
And the issue of, we talked about it, IJ touched on it. Pregnant women, you know, when a woman is pregnant,
She has not
generally
committed any offense, please.
and pregnancy can be as it is depending on the woman carrying it.
And at her most vulnerable,
Yes.
that's when she needs you to,
exactly,
you know,
to show care. I think beyond the healthcare professionals themselves in these hospitals, those receptionists, I think they are specially trained to be rude. When you come in, they expect you to know everything, to know where you're going. If you ask them questions, they get very upset.
That's what the private hospitals, where
At
you go
times
see reception. If you
Thank
go to
you.
a general hospital, you have to sort yourself out. Sort
you
yourself.
see this general hospital thing, eh? I'm so
let's
sorry
not
to
even-
cut you guys. My daughter's first, one of her immunizations that we went for, they walked my mother out, and they didn't even tell her nicely. Like, who is the mother of this child? I said, me. Who are you? I said, she's grandma. Oh, yeah, give the child to her. Give the child. Grandma, please, you go and sit down outside. Later, my mother said, she's, now needle
New
for her
mom.
child. She's not used to it. She said,
And as a new mom,
and then they
especially.
were so crass. Were you there when they were doing it? When she was doing it?
Can you
When she was
imagine?
opening her legs?
Can
you don't
you
say
imagine?
things
You
like
don't say
that.
things like that.
You don't say things like that. I'm
And
sorry. And the painful part of it is that this is coming from women, older women. Do you understand? You're supposed to be
usually
mommies
the
to us.
women
You
that
guys
do
have
these
done
things.
it. You
It's not
know,
fair.
you know the pain. You know the struggle. You don't say that.
It was probably easy for them. Like I mean, you may be a Hebrew woman, all powerful and all knowing. Maybe you sneezed and your baby popped out, but it's not the same for everybody else. When they cite pregnant women, I went to one hospital once, and all I asked was, how does antenatal work here? And she lost it.
She let loose.
Did they call you an elderly woman? Elderly pregnancy?
No, they didn't.
My pregnancy was
Even
termed
me too.
elderly. Because
They
obviously,
didn't.
childbearing after a certain age, I don't want to say the age, I'm not a doctor, I don't know what it is, but to them, apparently, after a certain age, your pregnancy is referred to as elderly. So as I am like this, I'm an elderly woman in the pregnancy world. It wasn't very funny. I didn't enjoy it. I know it's a medical thing, but I don't think it should have been said to me or
I was
Maybe
even
you
told.
should
The
have treated
nurses,
as
they
such
did.
and not told, actually.
The nurses
Oh,
didn't even infer in my case. They told me when I was complaining. I think I was complaining my legs were hurting or something on my back, and they're like, now old mama pregnancy.
I think it's very rude.
We shouldn't be
Now
laughing.
old
No,
mama
she's
pregnancy.
It's not fair. It's
You
not
know,
fair.
I mean, I found it funny then. No, I don't know. I think my pregnancy was just strange. Things that should have been annoying me used to just make me laugh.
And
I
then,
found it so funny.
Yeah, when you are in
You know, I
labor,
laughed.
when you are yelling out in pain, they get upset with you for
True.
yelling out in pain. Like,
True.
this one, it has never killed anybody. Please be strong.
Please,
Yeah,
I have to tell this.
Please do.
This is my friend. My friend said her maybe auntie or somebody went to have a baby in the hospital, and obviously the woman is well endowed, beautiful woman. She was in labor, prancing about, and one of the nurses just came out like, like,
Lord have mercy.
took a jab at her
Yes.
body type because she's in labor.
Like,
Took that
what
as
did
an
we ever do to
opportunity to take a jab at the woman's body type. Them nurse or whatever
Please.
you call yourselves. Please,
And
this is actually getting to
Yes.
me. You don't have a right.
Thank
If somebody is feeling poorly in health, whether she's pregnant, a man or a woman, they come to your health institutions, you cannot be unkind to them.
And please
be
note
kind.
that these pregnant women are not, reacting back. It doesn't mean they don't have fire in them or they don't have the talk to talk. It's just that they are just trying to maintain so that you will not jab them like that nurse jabbed you. They're just trying, let me just have this baby in peace. Like, namaste. Whatever you say, ma'am, it doesn't mean that they are stupid or something.
Yes.
Yes, some of them, I think maybe our viewers will have to let us know if they've actually gone back after delivery to say, yes, baby is out.
I don't think
Here we
Come
are.
prepared for you.
Yes,
I'm not
you
sure.
said this on this day. Then that would be something.
Okay,
That
so
would be
viewers,
something.
you've heard it from IJ. Let us know, what are your experiences as it relates to hospital matters? Are you a cranky nurse? Tell us why you're a cranky nurse. Let us understand. It might just be something about the profession here in Nigeria that gets them worked up. take to our social media streets and let us know. When we come back from the break, we'll delve in a bit more. Don't go anywhere. Ladies, can you imagine what she was just saying? Viewers, one of our crew members was just telling us of a terrible experience she had with her niece. They went to the hospital. Her sister had a newborn baby, and the nurse came in a day old. The nurse came in cranky. Even when they were greeting her, was problem to answer, and then winded up administering the wrong medication to that baby. The baby's life could have been lost. Can you imagine? This is what we're talking about.
Like, leave your problems at the door and
just
come and
be professional. Exactly.
My own experience, my child was going to be administered or transfused with blood. She didn't. They mixed up the files.
Oh Lord.
Out of their cranky, their impatient, Lord. They took another child's file who needed blood transfusion and put my own child's file who didn't need blood transfusion. So that child was in one ward needing blood transmission but was not getting it, and they were about to come and give it to my own child. Please.
It's not to say there aren't good nurses, because I've had really good experiences with a few nurses, and I let them know, and I let the hospital management know. But most of the time, I mean, some of us go to the hospital already prepared. Like, we have our guards up already. Like, today, I'm just going to either keep my cool, or anybody that annoys me gets it.
Yes.
That it shouldn't be the case. And going back to this hospital matters, I really like this topic, because another side to it is all hospital security.
Oh.
There is
it's like I have experience in all of them.
I've been on admission rather, and somebody opened my room door and said, "Oh, sorry, wrong room." I was on admission. Like, I was wondering, like, where are the nurses?
So they just throw in.
Aside from being decent, how about, what if he had bad intentions?
Yes.
Maybe to harm me or something. He would have done it and gotten away with it.
Let me just you ladies. I was sitting down in a hospital reception once, a popular private hospital. Check yourselves. I was sitting, waiting to be attended to by a doctor. You know how they've taken your vitals and you're waiting. The next thing, this unscrupulous character man just comes with his ATM card. Excuse me, madam, my sister, she's in something. She's about to have appendicitis surgery. My card is not working. Please, I want to transfer to you so that some
funny
story. And I'm like, excuse me, sir, you are in the hospital. Surely you had planned for this bill somehow to be sorted out.
Yes.
Even if your ATM is not working, the hospital people will.
Exactly. Yes.
How about you ask the doctor there that, doctor, my ATM is not working. Please, why come down to the reception and look for a random patient?
And then when visitors come into some hospitals, they just find their way to any ward.
When I went to
Nobody stops them.
When I went to report the matter at the security, the guy had disappeared. No one could find him.
So basically, your security matters. You have people there that are ill, cannot, stand up for themselves if worse comes to worse. And then you have them lying down there and people strolling into their wards. Come on now. And then when you people finish, you come and hammer us bills.
That bill part. Our director was telling us about his experience with bill. He was like, Bill, don't forget to talk about bill. Please now, private hospitals. If we pay these bills, then we should get exceptional service.
Yes.
It's not a public hospital where we don't have a choice. In public hospital, it's practically free, so you get what they give you, which is not right.
Yes.
But in a private hospital, I've paid premium, and then you give me.
I expect premium
service.
And sometimes, there is this bias against those that come under HMOs.
Okay.
When you are a private...
Really?
Yes, when you are a private client or a private, patient, they treat you with a certain type of care, because they can throw you any bill and you pay. Private patients. But HMOs already have prearranged, costing with these hospitals.
Right.
So now I think they discriminate amongst those HMOs. They know the HMOs that pay.
Yes.
So if you are with a HMO that doesn't maybe pay
at
promptly,
default.
Exactly, for whatever reason, you will sit at that reception. You will sit. You will see people going in and coming out, saying hello and goodbyes to you. You'll be there. The hospital staff, they won't explain to you why you're waiting. Sometimes you hear people yelling, I've been here, I came before this woman, da 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 da. They won't explain to you that they're trying to probably trying to reach the HMOs to find out if that is covered under your plan. They won't communicate anything, nada. You will just be there sitting and waiting. So when they see that you're under these HMOs, they'll be like, oh, this HMO gives us headache. You wait. You, the client, you suffer for it.
Well,
But private patients, yes,
so
now
wrong.
private patients, as soon as you walk in, you're paying for consultation, you're paying to get your card, registration, you're paying for your drug, you're paying for everything. So at times, they give preferential treatment to those.
But these HMOs, they should even do better.
Exactly.
I've had to, I couldn't wait for my plan to end, and I fled from that HMO because it was always a case of when I get to the hospital, then I'm having to fight with somebody every time.
The thing is, it's two-sided. I'll speak as a HR person who deals with these HMOs. When I'm choosing HMOs, for the staff, what I do is, like you said, those HMOs that don't pay on time. You will know. First things first, as an employee or as a what's it called? Somebody under a HMO plan, know your plan, know what it covers, know what you're entitled to. So that when you get there, even if the hospital reception doesn't know what your plan covers, you can tell them, and then you can put a call through to your HMO to verify.
Okay.
So that covers you and it saves your time.
Okay.
And then if you see that for some reason this HMO is always defaulting, change, switch. That's why I always advise companies to don't pay for a full year's HMO plan. Pay by annually.
That's very wise counsel, actually.
Pay by annually, so that 6 months, if you're not feeling the HMO, you flee.
IJ, you've given very wise counsel. Companies out there, I hope you've heard, when you're picking HMO, don't just do anyhow and just say, should be HMO na HMO. Be careful in terms of the defaulting ones.
Yes.
Be sure you know the ones that will default. And as IJ said, don't pay for a full, IJ?
Yes, a full year. Pay by annually.
Okay.
To help you.
Okay, so again, these are our own experiences.
Yes.
Tell us on social media. We've not really covered it to the extent that we would want to, but we're out of time. So go to social media, let us know your own experience with hospital matters, even the HMOs. You can, if you work for an HMO, you can chime in, let us know what the issues are, why you are not complying.
As usual, Yetunde has said it all. This topic is very broad. This hospital issue is very broad. It has different dimensions. But we've said what our time would allow us to say. So the conversation continues on our social media. Jump in, chime in, and then let us know what your experiences have been with these healthcare providers. And as usual, as we always say, ladies, speak it like it is, keep it 100, and always be considerate.